Well, I have some questions. And instead of asking a genius to come up with them, we came up with these questions in a group. So I hope the questions will be worthwhile for your time. But I have to say something. You just mentioned how in a perfect condition, we could potentially live 120 years. Now, you're the smartest person I know. So you subjected yourself to being president of the United States, which can't be stress-free. After your presidency, you now are carrying the weight of the world. So tell me the logic of that, Mr. President.
Well, first of all, I'm working as hard as I ever have, but it is less stressful. And secondly, there's a lot of evidence that activity keeps you alive if you still get plenty of rest and you get some exercise. I mean, I went last year to the 90th birthday of Shimon Peres in Israel, and we've been friends for a long time. He's still the president of Israel. And to the 90th birthday party in New York for Henry Kissinger, who has been uncommonly nice to Hillary when she was Secretary of State, notwithstanding their different political party history. And Henry's mother lived to be 98, so he may just have good genes. But these two guys are unbelievable, and they just keep going, and I think one of the reasons they're still around is they keep going. And now, you know, and I try to follow the latest developments in brain research. Last year it was clearly established that even though our brains begin to shrink when we're fairly young in adulthood, we still got a lot of juice left in them, and new neural networks can be formed by people at least into their late 60s. So I just got a few more years there. I'm trying to think of 3 or 4 things I want to learn before I turn 70 and my capacity shuts down. But anyway, I do this, you know, being happy has a lot to do with it too. This makes me happy. I'd rather do it than anything else.
Cool.
So I think the trick is knowing when you've reached your limit.
Well, we're grateful to you for doing it. And we hope you 120 years of life.
Well, I just want to live to be a grandfather.
That could be soon.
I've already outlived every man in my family on both sides for 2 generations. You got to go back to my maternal great-grandfather. He lived to be 76. But he was never out of overalls and hobnail boots. He lived out in the country about 15 miles from this little town in Arkansas where I was born. He was unbelievably a good man, but he went to bed with the sun, got up with the sun, had no vices, lived a stress-free life. It's a little late for me on that. But I'm doing my best to make up for lost time here with whatever damage I'm toting around.
Mr. President, I had the amazing opportunity that you gave me to travel with you through Africa a couple of summers ago. And I saw firsthand the incredible work you're doing on a huge scale. What inspired you to do that?
I believe that most people do not want to waste their work life. You know, I think most teachers who get up and go to school every day want to be good teachers. I think, you name it, whatever it is. And I think that one of the great good news stories of the last 20 years is the explosion of non-governmental organizations in America and around the world. That's what this is. That's what your foundation is. Non-governmental organizations in America are older than the United States government. The first one was the Volunteer Fire Department Benjamin Franklin established in Philadelphia before the Constitution was ratified. Why did he do that? He did it because people didn't want their homes to burn down, but there was no tax base to pay for a public fire department. And since most of the houses were wood, enough of them burned down before you got there for there to be a profit in it. So nobody could set up a business. So they set up a volunteer fire department. It's been an enduring thing. When I became governor of Arkansas, we had the highest fire insurance rates in the world, and I organized, equipped, and trained people to be in 700 volunteer fire departments throughout my little rural state, filling the gap between what the private sector can produce and the public sector can provide. In the modern world, non-governmental organizations led by the Gates Foundation, which I still think is the best foundation in the world, only partly because of the money they got, partly because Bill and Melinda Gates have assembled a stunning team of people and they do great things. But I've always been interested in how things get done. I think you can have all the good intentions in the world. If you don't know how to turn your ideas into real changes in other people's lives, you might as well be swinging in the back porch, singing a song. So I tried to figure out how to help people do things faster, better, at lower cost, and take it to scale. And I figured because I'd been president and I still knew a lot of people around the world and had a lot of friends, I might be able to do that. And we had all that success, which you mentioned earlier, with the AIDS drugs. And eventually we got Pfizer to be the first major pharmaceutical company in America to drastically slash a product it made, which is the only medicine in the world that treats tuberculosis in people with AIDS that doesn't make them so sick they think they're dying. That is, only Pfizer produces this medicine that will give you quality of life as you treat your tuberculosis and treat AIDS. And we lose over 400,000 people a year, or we were, to tuberculosis who have AIDS. So, you save a couple 100,000 lives, you feel pretty good. And when you get 6 million people on the world's least expensive high-quality AIDS medicine, you feel pretty good. Or if you can increase 20,000 farmers' incomes 500%, you feel pretty good. I just thought, given the life that the American people gave me, if I didn't do this, I'd be kind of a schmuck. And besides that, I like it. I have more fun doing this than anything else I could do.
That does not seem to bother
Well, you were there. You
presidents.
saw it. You had a good time.
I saw it. What I saw, and we've been talking about this, is how love of what you do is what makes the difference. And what I saw in you, you love people. I saw you from early morning visiting a soybean farm in Rwanda, to visiting a school that's been built in Uganda, to HIV clinics. And then in between, you'd come and talk to us. At the end of the evening, you'd be the last person to leave, late at night. And I think it's the love of the people that you have for all people that I think makes you do what you do.
Well, I give my family a lot of credit for that. I mean, I was born at the end of World War II in a state that had a net per capita income just a little above 50% of the national average. And nobody in my family had ever been to college before. The smartest person in my family, I still believe, was my great uncle. I believe he never had his IQ measured. He had about a sixth grade education. I believe, based on my lifetime of conversations with him, his IQ was over 180. I mean, I grew up in a time when the guy pumping your gas, back when you actually could get people to do that at a service station, might have an IQ higher than the town doctor. It's just their life chances were different. That's the same thing all over the world now. So it made me interested in people. We didn't have a television until I was 10. I think if I had been born 10 years later, I never could have become president. I really think growing up in a storytelling environment where I was taught that nobody was any better than anybody else, they just had different chances in life, it made a big difference. So yeah, I still get a big kick out of that. I mean, this summer when we went over there and I went to see one of these farms that we're doing in Malawi, essentially what we're trying to do is get 200 to 400 acres that can be like a research station. And we can buy seed and fertilizer for far less money in bulk, and then we give them to all these small farmers. Then we make sure they can get their crops to market without having to pay 50% of the price to get it. Then we teach them how to take care of the soil and all. So I came up to this lady who was planting seeds, literally with a hoe, a handheld hoe like this, down on her hands and knees. And she looked at me. She didn't know who I was from Adam. She knew I was some gray-haired guy that was helping them. She said, "You think you could do this?" I said, "Yeah, I know I could." She said, "Why do you think that?" I said, "Because I've done it." And she said, "I don't believe you, do it." So she gives me her hoe. So I'm down there planting. She said, "You were telling the truth." I said, "Yeah, look, you can." I said, "I want to get you better equipment. You shouldn't be farming a whole acre with a handheld hoe, but you need to make a little money first, and we're going to increase your income." Oh, she said, "I'm making a lot more money. I'm going to be fine." That's an important thing. People can undergo any kind of privation as long as they think that tomorrow can be better than today. The thing that's killing people in America and around the world is that they think all their tomorrows are going to be just like today. That's a very important thing. That's why all of you should be concerned about this stagnant wages, loss of mobility. Literally, I mean, I just went to my friend Nelson Mandela's funeral, and I was thinking about it. You know, he was like a young man when he was in his late 70s being president of South Africa. And part of it was he literally, through all those years in prison, from 27 years, he never doubted for a moment that he would get out. And that when he got out, either he would be president of South Africa or his people would be empowered to vote and control it. So he could endure everything. It's very important to remember that in this economic crisis. Do you know that in the last decade, America's life expectancy went up in every category except one? Non-college educated white Americans. Female life expectancy went down 4 years, male life expectancy down 3.5 years. Why? The nominal reasons were an increase in smoking, more among women than men, an increase in obesity, and an increase among younger people of prescription drug-related deaths. But you might say they died of a broken heart. You might as well say that. I mean, people that adopt knowingly self-destructive patterns, or in the case of obesity, probably feel that the walls were closing in and they didn't have a lot of choices in how they ate and prepared their food. Or people who believe that their tomorrows are not going to be any different than today and yesterday were. So I think it's really important. That's another thing. Did you see how you were clapping for yourself when I said 575 lives were saved in the first group of hospitals? You understand what that means? You do. Put 2 years together. Have a good 2014. Have these 60 hospitals do it. It'll be in every news outlet in America. It'll be all over the world. And people will say, "Oh my God, we have to do that." I mean, we can talk. I do believe the pay for performance incentives in the Affordable Care Act will help. But I think the main thing is, if nobody goes around in healthcare wanting people to die. Nobody wants to fail at what they do. Nobody wants to feel that they made a mistake in what they did or didn't do when someone was in the hospital. I just think a lot of people just don't think things can be different. That's why this is going to be exciting. You wait till these numbers come out. This year, you have another banner year this year. You put the 2 years together. You show how the participation increases. This thing will be like wildfire all over the world. Just because basic human decency, the impulse to live lives of meaning, and the thrill of thinking, "Oh, thank God, here's something could be different tomorrow."
Mr. President, I don't believe that woman in Malawi did not know who you were. You're beloved around the world. I remember in Rwanda, a boy was named Bill Clinton as his first name after you. And I live in a county, by the way, that probably is in that 48% category of, in this case, being Republican. And I have a lot of Republican friends that said they would vote for you. So, but one thing I wanted to just...
I want to say one thing about
Yes.
that boy. The Africans are wonderful, and they have wonderful, they're different. And remember, Africa's a continent, not a country, so it's wildly diverse, much more than people think. But when Hillary and I went to Africa in 1998, we went to a village in Uganda because I wanted to see these projects that American aid had funded, helping people start small businesses in this little village. So this lady brought me the youngest baby that had been born the day before I got there, and so they named the baby after me. Then when I went to Senegal, I went to another village to see some other projects we'd done, and it was right on the edge of the desert, and they had named a goat for me. And we spent the whole rest of the trip trying to figure out which was the greater honor in their eyes. I'll tell you a nice story. I was about, not this last time, but the year before when we went, I went to Entebbe in Uganda, where a lot of you remember they had the famous raid by the Israeli soldiers. And Prime Minister Netanyahu's brother was killed in that raid. He was the leader of the Israeli forces and the only casualty when they liberated all the people who were spirited there. But anyway, the president of Uganda, with whom I have many disagreements, but a long history, and we do a lot of work there, flew that little boy to see me, whom I held in my arms when he was 2 days old. And he's a tall, skinny, rangy kid. He's a good student. Mother's working like crazy to pay his school tuition. One of the cruel ironies of being poor in a poor country is that because they don't have much tax base, poor people have to pay tuition to send their kids to public schools or private schools. So we're all kind of helping him. But it was quite moving to go back over all that time and see that child. He's a very handsome, smart kid.
Of course. And I have a feeling that village that named the goat Bill Clinton must have been a Tea Party village. But
Oh, no, he's got to be careful where he goes in America with that name, but I think
Mr. President, when we shared with you the data, we shared the 575 number, and I'm happy to tell you by Friday when we're tabulating, it was what we call 1 plus 601, because everyone counts. So, and I think by today, the numbers may have increased. So yes, we're beaming over that. Of course, you have saved so many people's lives. So obviously that keeps you young. But I want to ask you, you've got so many people asking you for your help, your bump. Like the bump you gave Vice President Obama, of course ours is like 5,000% the bump you gave us. But why did you choose to be part of the patient safety movement?
because, first of all, because you stood up and said you wanted to save 200,000 lives and you were convinced you could do it. And you had what I believe is the only way to do anything like this. You were going to get all these people involved in it. I mean, so that's the first thing. The second thing is, I believe we have to find a way in America to improve the quality of health care and over time lower the percentage of our GDP going to health care and costs so that we get closer to our competitors. Japan has a longer life expectancy than we do. We've got a Japanese doctor here. They spend 9.5% of their GDP on health care. 4 years ago, we were at 17.8%. Because of the changes that have been made in the last 4 years, maybe aided by the slow economy, but mostly because of changes, it's dropped from 17.8% to 17.2%. We've had, for the first time in 50 years, we've had 4 years of health inflation at 4% or less. And it's because of people like you doing things that make sense, working together. And I thought on a pure human level, when somebody, I've learned not to underestimate you ever since you sent me that little machine that I could put on my finger and measure my blood health. And when somebody wants to save 200,000 lives, and you actually think they've got a chance to do it, it's kind of like you pulled up outside my house in a Rolls Royce and asked me to take a ride. I'd be a fool not to do it. And secondly, I think it's improving the quality of care and making fewer mistakes and having to undo less. You see, you're talking about the lives you save. Think about all the people that get sick in the hospital and don't die, but have to be readmitted. One of the reasons I like the Geisinger healthcare network in eastern Pennsylvania is they got, 700, 800 doctors, and they all live with this massive book of the latest information on best treatment, and they treat medicine as first a science and then an art. And if you enroll in Geisinger and you have to go back to the hospital within 90 days for any reason related to your treatment, they foot the whole bill, and your copays and deductibles will never rise, nor will your premium rise as a result of it. They absorb all the loss. So for years, their medical error rate has been hovering around zero because their whole business model depends on better outcomes and higher quality care. So you propose to do that and save 200,000 lives to boot? I mean, it's a great deal. You guys, you should be really happy when you go home from this meeting. And then, just think about it. It's a big deal.
Thank you, Mr. President. I think that may have been my last question, although I've got another dozen I wish I could ask you, but I know you've got other commitments. Any closing thoughts, anything you want to tell the people that admire you so much, that are here to do great work?
Yeah, I think I didn't say as much about this before, but I think that, as you know from what I did say, some of these problems with the implementation of the Affordable Health Care Act were predictable. The real problem is that the political polarization is such that we don't have the consensus to fix them as quick as we should if they require an act of Congress, for example. And you can ask Senator Harkin about this. You're going to give him an award.
He's going to give us an act of Congress.
I mean, he's been great. Look, if he'd been making all these policies for 30 years, we'd be in a different place. But I think you've got a doctor who's a congressman from this district, or at least the one just south of here. You've got a lot of people who are interested in this. You got medical device people who hate the tax. If you want to get rid of it, you ought to say how you'd replace it. But the thing is costing less than people thought. There is a fund that is supposed to flow that most Americans don't know about to help deal with problems in the market where people don't get the same or better health insurance in the individual market for the same or less money. So that's out there, but we don't have enough people enrolled yet to know with certainty who should get it and how it should flow. But it will. There's money out there. I think if you have specific ideas that go beyond just the fact that you need to be able to get on the website, see what your options are, make the best choice you can. You should share those with Senator Boxer, Senator Feinstein, and members of Congress. If there are problems with the implementation in California, I know it's interesting, Mr. Lee, the guy that's running the program here in California, his uncle worked with us 20 years ago in Washington when we tried a much simpler but equally controversial program, because I wanted to do what the Dutch did. You know, the Dutch system, one of the questions he didn't ask me is, do we have anything to learn from other systems, right?
I'd love you to answer all my questions.
The answer, well, look, I have a different theory than most people do. I mean, I would look at every country in the world that spends a smaller percentage of their GDP than we do and has longer life expectancy than we do, and I'd see what we could learn from them. Japan, for example, we're at 17.2. They're at 9.5 max. Average hospital stays in Japan are longer than they are in America. But the main issue there is providers make a lot less money, and you're not going to undo all that, which is why I think it's a really remarkable thing that we've gone from 17.8 to 17.2% of income. We need time to adjust this system so that the things that we want to invest in, including paying the best people decent salaries to go and do this work, are spending more than a lot of countries do on biomedical research, are doing more to protect the intellectual property of the drug companies or whatever the heck we're doing, that we decide we want to do, we can do that and still drastically cut the difference in what we spend and what everybody else does. But if you have specific ideas, I think you ought to offer them. But I also think that we should look at what other people do. The Dutch, for example, have no Medicare, no Medicaid, 100% private insurance, individual mandate. And they just subsidize people based on their income. So once you reach certain income, you start getting a check to defray your premium. But everybody owns the same kind of policy. Much simpler than our system, but it's a little late to put that in. But they also have a health budget, something we don't have. I went to the 200th anniversary of a massive international insurance company headquartered in the Netherlands called Oxia. And the chairman is one of our partners through the Clinton Global Initiative, like Joe. So he asked me to come to their 200th anniversary. And they started in this town called Oxum. It's about an hour outside Amsterdam, little farming town. And it was rainy and windy that day, and we were under a tent in the shadow of a church built in the 1200s. And they started with 39 farmers forming a fire insurance company and became this great international giant. So we're about to go up and start the program. I said, well, let me ask you something. I said, you write health insurance? Imagine hearing this in America. This guy runs this massive. He said, yeah, we all do. But he said, we don't make any money on it. And we shouldn't. I thought I'd fall out of my chair. I said, why do you say that? He said, healthcare it's a public good. And we should put the money into healthcare, not into financing it. He said, we shouldn't make any money on that. He said, they gave us enough money to cover our paperwork costs. You got to finance it some way. Somewhere, years ago, somebody decided we'd finance it through private policies and just subsidizing people on their income. So we don't lose any money. We just don't make any money. And that's exactly the way it should be. He said, if I can't make money in the traditional insurance business running this company, I don't deserve to be the president. I mean, a lot of this just depends on how you look at it. But the interesting thing is everyone knows there, and he doesn't get hurt with his investors because there's a law with the budget. So he's not, if somebody tried to do that in America in a for-profit company alone, they'd be hurt. So we'd have to change the law for that to become the mindset. But I never will forget it, sitting there with that guy saying, we don't make any money on it, and we shouldn't. I thought I would croak. And I leave you with that. We need public-private partnerships too, but this thing's complicated. The individual market is complicated. As I said, half the people are in it for less than a year. 80% of the policies don't last more than 2 years. And we're all just kind of feeling our way along here. But the individual insurance market is a small part of a big healthcare system that is already being benefited from the elimination of pre-existing conditions, from the requirement that 80% of your premium has to go to healthcare, or 85% if you're in a really big plan. and from a number of other changes. We will get there, but if you have specific ideas, if you get them to me, I'll feed them to the right places. But a lot of you are living on the receiving end of this, and we have to identify, let's say there are 100 things that ought to be done. We need to analyze what things could be done by executive action, what things would require congressional action. How would we put these things together so that both Republicans and Democrats would want to vote for them? Can we do that? Because that's one of the things I'm worried that we'll find 3 or 4 things that really need congressional action, and the people that have a big vested interest in the whole thing failing won't want to pass it. So you're going to have to package this in a way that will attract broad-based support. My gut is you could find a way to do it, but it's not going to be easy, and we need specific suggestions. So if you have any, I'd be glad to have them. And I don't have a dog in the hunt. You know, I'm not running for anything. I just want this to work. I don't want to wake up 10 years from now and see countries with 1/4 our per capita income with longer life expectancies. We can't tolerate it. And we can do better. So I want you to hurry up and get rid of this 200,000 deaths so you can take on something else.
Thank you, Mr. President. Mr. President, before you leave, just one last thing, Mr. President. We have 5 individuals I'd like to bring up to introduce to you. They are the ones that are responsible for the 1+601 lives that we saved until last Friday. If I may bring them up just to meet you. Please, from great institutions, Maureen Despot from Houston Methodist. Michael Ramsey. Let me just read it in respect of President Clinton's time. Michael Ramsey, Baylor Scott and White Healthcare System. John Carlson, Mercy Hospital of Buffalo. Robin Betts, Intermountain Healthcare System. And Peter Cox, Hospital for Sick Kids. If you could please come up and meet the President. Okay.
Excellent.
Thank you. If we could have you all come out here, we're going to take a picture together too, please. Thank you. Is right here good? Yes. All right. Let's do it. Thank you. Please come closer. Thank you. A little closer. Not around. Thank you so much, Mr. President. Thank you. Thank you, Peter. Thank you so much. Thank you, Robin. Thank you so much. We hate to see you go, Mr. President.
Thanks.
You have really helped us make this movement possible. You really have. I can't tell you how much we appreciate what you've done.
Bless you.
Thank you, Mr. President.
Thank you.
Thank
all.
you.